Good morning and good evening, depending on where you are. My name is Dr. Harriet Babikako. I work with Makerere University in the Department of Child Health and Development Center. I'm here to talk about the initiative. Challenges in identifying children with disabilities in early years, a qualitative account from Malawi, Pakistan, and Uganda. I'm presenting on behalf of my co-authors, Dr. Amy Mabel, Ms. Munira Rashid, and the Indigo team at large. So this is going to be my outline. About 1 in 10 of all children have a developmental disorder, with the greatest burden in the low and middle-income countries. With recent improvements in neonatal care, many infants are now surviving with perinatal complications. Although limited focus on the routes of identification and management of children with these disorders. And early identification and intervention can improve outcomes of such children. Our study aims to explore the barriers and facilitators that exist in identifying children with disabilities across the 3 high-burden countries, and to understand the experiences and perceived pathways to identifying the children with NDD in schools, communities, and hospitals. Our study locations were Mulago in Uganda, Quench in Malawi, and Aga Khan in Pakistan. We used a qualitative and descriptive study design, and the data was collected between January to November 2019. Ethical approval granted by 4 ethical committees in different countries. A passive sampling was done where hospital and community contacts with experience of looking after children with disabilities. A total of 18 FGDs and 49 in-depth interviews were carried out, and data was transcribed, translated, and analyzed using individual coding across teams with co-coding until clarity about the things and sub-things was achieved. These are characteristics of our participants, caregivers, and the tertiary healthcare providers, professionals from schools and rehabilitation centers, and community health workers. And at the extreme end, the percentage of female that were in the groups. So our results are presented using this conceptual frame of demand and supply. So some of the factors, the demand factors that have implications on early identification and support included blame, embarrassment, stigma, and shame. If a child suffers from a fever, he will be taken to a doctor, but if he has a speech delay, parents will not seek help. Even I have observed that the elites don't seek help either. Secondly, the etiology of disability. Professionals report that parents believe that witchcraft can work more than modern medicine. Sometimes parents will be given medicine from the hospital, but they may still continue to practice a traditional cure, such as bathing a child in herbs provided by a traditional healer. Thirdly, knowledge or awareness of normal development and disability. Some parents had some understanding of normal child development based on their experience of caring for their children, but also observing them in the community. And the factors are the supply factors of services and support from health institutions and professionals included knowledge and training on care of children with disabilities. Healthcare workers had some knowledge of the definition and causes of disabilities in children, but had variable knowledge and little reference to standardized tools for assessment. And teachers were seen as a focal point for identification of children with special needs. Secondly, limited access to community services was found. The rehab workers are few, so it's difficult for them to visit community regularly. Thirdly, the weak referral pathways. Health professionals describe the benefits of multi and cross-sector agencies working together to help parents access services. This schema shows us the deduced work frame, the community issues, structural issues, and lack of service provision all can lead to delay in referral of children with disability. And this schema describes ways to address the demand in knowledge and service provision at community level. So if we can provide knowledge at the community level and create intergovernment and sector working groups, and also improve service provision and training of the health providers, educationists, and the social welfare, this will lead to early referral of children with disability. Some of the implications of our study, it has strengthened, our findings strengthen the pathways for early identification and intervention with regards to management of children with NDD by enhancing training of health workers in child development screening and data collection, and develop ongoing linkages between health system levels and across sectors like education and social welfare. Review policies and incentives that can be put in place to improve supply structures, that is through better system referrals and multi-agency approaches and increased funding. And lastly, to generate effective monitoring of the systems to ensure good fidelity of the piloted structure or system. Our work was funded by MRC Mental Health. Thank you.